Behavioral health and addiction. Addiction can happen to anyone, anywhere, anytime. This is tearing apart the social fabric of our communities around the country. And from a state level, we ought to do everything we can to try to reverse that trend. And it's staggering, the numbers nationally. We will have more overdose deaths in 2017 than auto deaths plus gun deaths combined. It will be the worst year in the history of all of us saying, hey, we're going to, war on drugs, which started in the 1980s. Worst ever in terms of overdose deaths. And it's driven by more powerful and more fatal drugs, a lot of them related to opioids and fentanyl. And North Dakota is not immune. Numbers aren't in yet for 2017, but probably 70 plus overdose deaths last year in North Dakota. And so we need to attack this on a multidimensional front, but we need to start with the understanding that addiction is a disease, and you can't treat a chronic lifetime disease with 28 days of treatment any more than you can treat diabetes with 28 days of insulin. We have to change our cultural view of how we think about this, and that'll change our approaches. You can't incarcerate people who have a health issue and expect them to get better if they're not getting treatment while they're incarcerated. And as Leanne Birch says, who leads our corrections, is doing a great job of that. We have 98% of the people in North Dakota get back out of incarceration. We need to be making better neighbors, not better prisoners. We got to make better neighbors. And in many states, there's a tie between this and workforce that we can also be tapping. But we are making some progress. Opioid, and awareness efforts, we've actually reduced about 11,000 fewer prescriptions in 2017 and 2016. We had a statewide task force that was looking at that. Some of that involved changes in the software, people dispensing it. Some involved getting the dentist more involved. But there's things we're going to keep chipping away at all this. But it's staggeringly high. There was almost 60 doses per every man, woman, and child prescribed in our state in 2016. 60 doses for every man, woman, and child. I don't think we need that much pain medication as a state. So we need to think about how do we use it appropriately, and how do we make sure we manage the supply and manage the challenges of the disease of addiction. One of the things that we did to bring attention to new approaches on reinventing recovery was an event. The First Lady helped drive this event, and it was fabulous turnout, fabulous speakers from all over the country that were there. And at the end of the day, it was interesting. People got done, said, "Do you love the speakers?" Speakers were amazing. 5 of the people that spoke today on stage at this conference were felons. The woman from LA, the lawyer who works in Hollywood, felon. It's like we have to understand that we have to get rid of the stigma associated with this and start looking at the root problem. And so we are, and the First Lady has been doing amazing work. Prior to this, part of the ideas and the speakers that came for this event came from her 5 visits to 5 other states, to 5 other governors on her own dime and her own time. New Hampshire, Vermont, Massachusetts, California, Arizona, New Jersey with Chris Christie. Anyway, bringing ideas and bringing speakers back to help catalyze this thing, and then great teamwork from Pam Sagnas and her team in Human Services. Great teamwork effort driving this thing. One of the things that happened at that event was we said, let's give out Narcan. Narcan is the nasal spray that can reverse an overdose. Some people said, well, this is North Dakota. A, we don't have a problem, and B, why are we giving out something that's just going to support addicts? That's the kind of language and thinking we have to get rid of. This is a life-saving tool for people that have a disease. 326 kits were distributed after we gave training on stage. 5 days later, there was parents that came. The parents came and listened the whole day at Recovery Reinvented. They left with their Narcan. They were there because they had an adult son, early 20s. They were concerned about his addiction. 5 days later, they come home. He's unresponsive on the bathroom floor. The dad applies the Narcan, saves his life. Saved his life. And the legislature and the judicial branch they're on this. They're on this and they're making great progress. Passed a bill last year, one of the most significant pieces of legislation, the Justice Reinvestment. This moves $7 million out of corrections upstream to start working on solutions, keep people out of incarceration, get them into treatment. The brand name for that effort coming out of Human Services is Free Through Recovery, and this is to try for us to support up to 600 people with services previously not available in North Dakota. And if we can provide 600 people with services and keep them out of incarceration, it costs all of you, not the state of North Dakota, it costs taxpayers $41,000 a year to incarcerate someone. It costs a fraction of that for us to give them treatment, and then they can be with their family, with their kids, working, generating taxes. It is so, war on drugs is tough on taxpayers. That's what it is. We need to come up with solutions that solve the problem and work for taxpayers. So anyway, we need more investment in this going forward. But again, great team effort. Had the first training yesterday morning. The First Lady was there, spoke. Pam they had about 25% more people show up than they thought they're going to in terms of people around the state. They're going to work on this, but it's fantastic. At the federal level, your First Lady's also been very busy. Last week, she's getting a shout out from President Trump. She's met with the White House drug czar, Richard Baum. She met with the FDA Commissioner, Gottlieb. She continues to build these relationships at the national level and do that. And I would just want to say to the First Lady, your courage to put yourself out there on this thing is amazing, and it's making a difference. So thank you. Thank you. Coming up next, recovery is one of the elements. We want to focus on prevention, we want to focus on early intervention, we want to focus on treatment, we want to focus on recovery, the four elements when we're approaching this holistically. We had the day focused on recovery. Now this spring we're having a day of prevention. Register at recoveryreinvented.com. I challenge people to get there, particularly if you're